When Doris Ann Price learned her breast cancer had returned after 13 years, it hit her like a truck.
I truly felt out of control in my life. You know, I felt really weak in my stomach.
Catherine LeBlanc was walking out of her surgeon's office after her diagnosis when the realization swept over her.
My mom stood up and I almost knocked her down, you know. That's when I knew, you know, like, I may be a little bit calm, you know, calm on the outside, but I'm really sort of out of this.
Carol Gray faced the diagnosis calmly until she had to tell her family.
I said to my husband, "Oh, I just hate to tell our kids this," and that's when I choked up, because I just hated to have to say it to them.
Being diagnosed with cancer is hard for anyone.
When you're told that you have cancer, I often describe it as like being in a wave where you feel you're upside down in the water and you're very disoriented. And so you have a lot of, you know, physicians telling you different things about your diagnosis. You're in a state of confusion.
Many patients feel their doctors don't treat them like a complete human being, but instead simply list a set of clinical steps to treat their cancer. That was Catherine LeBlanc's experience with her first doctor.
The surgeon there had recommended that I have a mastectomy and that I then have chemotherapy and then radiation.
Catherine wanted a second opinion and began looking on the internet for a hospital that would support therapies other than the surgery, radiation, and chemotherapy she knew would be part of her cancer treatments. She found it at Duke University Medical Center in Durham, North Carolina.
I got the diagnosis and I was doing the research on Duke. One of the first things I looked for was to see what they were doing in the integrative medicine. And that's where I found Tina's program.
Tina is Tina Staley, the driving force behind an innovative program at Duke for breast cancer patients called Pathfinders.
Oftentimes there isn't the support out there, and there's no one in life training you to have cancer.
And so patients are matched with a Pathfinder who guides them in such things as complementary medicine, self-care, and mind-body techniques. The Pathfinders program looks at each patient in more human rather than clinical terms.
The approach at Duke that's different from other medical systems, particularly in oncology now, is a move towards seeing the patient as a whole person rather than as a disease. I think that allows us to focus on different ways of caring for the patient rather than just giving chemotherapy or radiation therapy or surgery.
In the Pathfinders program, breast cancer patients are encouraged to seek those unconventional treatments such as acupuncture, massage, and healing touch to go along with the conventional medical treatments.
We work with certified practitioners, you know, really in the program to help with, for instance, acupuncture. You know, we have just found that when you're very nauseous, that the acupuncture is the one thing that works.
Carol Gray had never tried acupuncture. After a visit to acupuncture therapist Lori Fendel, Carol found it was immensely helpful in relieving discomfort from her radiation treatments.
We worked on nausea, and we worked on stress, tiredness. So she did the various things that she had to do, and nausea has definitely improved, definitely.
Many times, these therapies are very useful. Sometimes, though, the doctors at Duke will steer some patients away from them.
Both acupuncture and massage aren't for every person with cancer because there can be risks for a person who has problems with their platelets or their blood or something else.
Catherine had found yoga was a great stress reliever before she had cancer. When told she would have to have a mastectomy, she called upon her Pathfinder to help her face the surgery.
I said, Tina, I need a ritual. I said, I need some kind of ceremony to say goodbye to my breast. And so on the night before the surgery, about 10 women gathered. Then we sort of touched the breast and thanked the breast for all that it had meant to me. And, you know, because I had breastfed my last child, I felt ready to release it.
Unconventional indeed. Doris Ann believes meditation plays a huge role in her cancer treatment. And so each day she begins her ritual by giving her spiritual thanks.
I say the Modeh Ani in Hebrew every morning. That becomes a way I connect not just with my moment, but with the universe. I feel, you know, part of something much bigger, and it makes me feel wonderful.
The Pathfinders program at Duke encourages its patients to develop that connection.
Spirit is huge. I mean, you can take away, many things from individuals. So much of someone's life has been changed. They'll often say, I've had so many losses, whether it's of sexuality, whether it's the loss of a job, the loss of their identity. But the one thing cancer cannot take away, I've noticed, is someone's spirit.
Well, as I tell my patients, I've never seen prayer hurt anyone, or meditation, or being in touch with your spiritual side. And I'm a firmly believer in if it's not going to hurt you, certainly try it.